Labor and delivery of a new baby is an exciting time for women and their families. It can also be an experience where the expertise of an anesthesiologist is extremely helpful.
It is important for women to be well informed of the options for pain management prior to delivery. An anesthesiologist can provide helpful information to women regarding pain control during labor.
Pain during labor is different for every woman and depends on a variety of factors. Some women need little or no pain relief medication, while others find that pain relief medication gives them better control over their labor and delivery.
The biggest concern for most patients, I would say, is that the epidural will not work as effectively as desired. In such cases, the anesthesiologist will make adjustments to provide the patient with adequate pain relief.
There are several pain management options available in most birthing facilities, and each has advantages and disadvantages. Some, such as receiving medications through an intravenous catheter, can be administered by a labor nurse. Others, such as the basic types of anesthesia used during the labor and delivery process, require a professional trained in administering anesthesia and monitoring the effects of the medication. These include epidurals, spinal blocks, a combination of both the epidural and spinal block, and if needed, general anesthesia. Each has its benefits, and women should work closely with their anesthesiologist to determine the most appropriate pain management for them.
Spinal anesthesia and epidural anesthesia are types of regional anesthesia that are commonly used in labor settings to relieve pain or to numb a specific part of the body.
Both spinals and epidurals are performed by placing a needle in the lower part of a woman's back. With a spinal anesthetic, a single injection of medication is administered and the needle is removed immediately and completely. With an epidural anesthetic, a catheter is placed for continuous infusion of local anesthetics and other medications used to provide pain relief during labor and delivery.
Contrary to myths frequently found on the internet, there is no credible evidence to show that epidurals slow labor, cause women to have cesarean sections, or lead to a higher incidence of babies having breathing problems.
If a patient requires a cesarean delivery, the anesthesiologist typically uses a regional anesthetic. The decision to use pain management treatments largely depends on the comfort of the mother. It is rare for the mother or the baby to encounter complications arising from pain management during the labor and delivery process.